On this video, I will show you on how to document in EMR. I will access one patient named as Yasasi Almusates. She's 61 years old, female. So once I will document, I will use this icon below. This is called provider's template. So once I will open this one, I can able to view my template, Aramco report. If I will do some investigation, treatment, or medication that requires approval from the Aramco, I will use this template. I have also a care plan post surgery. I will use this template if I did surgery for this patient. Consultation reply OPD. I will use this template if I have been consulted from the other department in the OPD. Consultation reply IP is the template to use whenever consultation happen in inpatient. If I will do consultation from the other specialty, I will use the consultation handover IP. DVT risk assessment, I will do this one if I'm planning to admit the patient. So prior to his surgery, DVT risk assessment should be done by the physician. Daily prognosis notes, this is done on a daily basis upon reassessing the patient. Physician assessment, this will be the template used in if I'm working in emergency. Handover SBAR, this is the template we are using if we are handovering the patient from ship to ship between physicians. Initial assessment, this is the template I'm going to use if initial visit encounter from the clinic. Like in inpatient, I will do the initial assessment if I'm planning to admit the patient. I will use the outpatient initial assessment if the encounter is in outpatient. Multidisciplinary discharge planning prior to admission of this patient. I will use this discharge planning if the patient can be admitted for how many days. I will use this template. For multidisciplinary patient family education, this is mandatory for every patient I'm admitting. Some other templates you can use also for OPD follow-up in outpatients clinic. If I have patients which is GUSI, the work-related injury templates I'm going to use. So this patient come to me, let's say initially on my clinic. So I will use initial assessment as our policy. If we are seeing patient first time in our clinic, we need to do complete assessment. By doing that, we need to use the initial assessment. This initial assessment will cover 6 months if this patient repeatedly coming on our clinics. So what we have here, we have the chief complaint. Take note, all the pink entries are mandatory. All labels with the red color is also a mandatory field. So let's start with the chief complaint. Chief complaint, it is mandatory. So we will ask the patient what is the reason why he or she is visiting in our clinic. Let's say this patient is complaining of abdominal pain. We will start our documentation and present illness and physical examination. What is the mode of arrival of this patient? Is he or she ambulatory? If others, you can check here on wheelchair or via stretcher. So let's say patient is ambulatory. So present illness, what happened? Why this patient having abdominal pain? So we can assess or we can write more description here regarding the complaint of the patient. Let's say patient visited in our clinic or complaining of abdominal pain after eating or after a meal from a restaurant. Let's say that is the present illness and why this patient is complaining of abdominal pain. Then upon assessing the patient and history taking, she is also complaining of vomiting for 4 times and has a diarrhea for 3 times. This pain is just not located specifically in the right lower quadrant. So we can write here also the duration, how much or how many minutes, hours, days this problem happened to her. Let's say she's complaining of abdominal pain and other for almost 2 hours. Pain is present upon assessing. Yes, he is. And the score, let's say, is 3. So we will click here. Take note, these are the mandatory field. Now we will go to the review of systems and physical examinations. So we have here by default as negative. So based on our assessment and the complaint of the patient, we can select here the specific entries. Let's say, for example, in the gastrointestinal, as patient is complaining of abdominal pain and has a diarrhea and vomiting. If you want to specify more on the complaint of the patient, you can use the others below. Initial care plan and measurable goals elements is this one is not mandatory. You can leave it empty. You can go to the history. So history, if for example, a patient has a previous history of sepsis, as this is the coded template, you can write here sepsis and it will give you the selection. Just like what it was documented here as sepsis unspecified, that's 2 months ago. Allergy, if patient has a new allergy or there was a documentation for a previous allergy, it will be reflected here and it will be reflected here. If patient is not known to have allergy, this NKDA will be reflected in the patient's banner. If we identify upon assessing the patient and asking his or her history, she added more that she has allergy to ranitidine, for example. So we can select here and you can write ranitidine. So we will click this icon and to select, we will assess and ask the patient what are the reaction if this patient is taking a ranitidine. Let's say if she's complaining of respiratory distress, she's complaining of itchiness and rashes. So that are the reactions that happen to the patient. We can rate here either by mild, medium, and severe. It is also by color. It depends to the level of or the severity of reaction. If you will select mild, it will show green. If you will select medium, it will show orange. If you will select red, severe, it will show us red. So let's say this patient is on mild the severity is mild. So here, it will capture the medication itself. One I will save later on, it will be reflected also here in the patient's banner. Clinical warning. Take note, clinical warning appearing here. This is where I will document. For example, if I identify this patient that has a contagious disease, so to alert the other caregivers, I will select this clinical warning. Then I will click plus to captured by the system. Special need, this is a template wherein to screen the patient if he or she needs to be referred from other specialty. There is mandatory field here as there's a label as colored red. This is the mandatory part. So as you can read here, there's a note. If patient screen in needs of special management and intervention, please click yes and specify the criteria. So if this patient need to be referred from physical therapist, we will click yes and we will, upon assessing, there are criteria which this patient falls. Like if there's restricted range of motion. If this patient needs to be referred to nutritionist, we will click also yes here and we will identify what are the criteria these patients belong. Like for example, if patient experiencing diarrhea, vomiting, nausea, we will click this one and this is for the purpose of documentation only. This is not a consultation to be directed or to the concerned department. This is for the documentation only. Diagnosis and plan. This is where we are selecting the diagnosis. So by default, it will show here as favorites. So if you don't have the favorites yet, you can use the start with. You can write the first word of that diagnosis. Let's say, for example, acute abdomen. So if you frequently using this diagnosis, you can make this as your favorite. You can write multiple diagnoses based on your assessment. And take note, this is by provisional, differential, or final. So if you are really assured that this patient is having a final diagnosis, you can select final. Let's say acute appendicitis. So here we can select multiple, but the system will ask you which one is your primary diagnosis. So you can select at least one of it. So this is mandatory. You need to select and take note this one below. This is also mandatory. Patient family education or material given. Yes, this is mandatory. So if you are working in a bariatric department and this patient for you is related to bariatric, you can use this heading. If you're working also as ophthalmologist, you can use this ophthalmology assessment. This part below is multidisciplinary patient and family education. This is mandatory for every outpatient's encounter. This is the template you are going to use that has also a mandatory fields. You will start here patient and family education given yes or no. Patient initial, as this is the initial visit of the patient, we need to select initial. The willingness of the patient is auto click as yes. Level of education, so here we will ask the patient and we will level the the education of the patient based on her